Hi guys, how are you and welcome to my YouTube channel. I am really glad and excited to have you on board. I have been away for quite a while. In our country, Kenya, it's been a year of elections, and for some of us, results didn't really go the way we expected. So we've been going through that period of acceptance. Yet at the end of the day, we have to accept and our country has to move forward because we are a great nation in Africa, in the world, and this country has to remain great. Now, today I want to do a detailed topic on emergency contraception, the morning after pill, what we mostly use as ladies, as men, and as partners. You give them to your girlfriends, right? And we also use them in hospitals in various circumstances. So I went to the chemist here in Kenya to just find out the available brands that are there for the morning after pill. So commonly we call it P2 in Kenya. Now we have this one. This one is called Postina 2 levonorgestrel. It goes for 200 shillings in Kenya. And then we have this one I've also found. It's called Choice 72. It goes for 100 shillings in Kenya. And we have this one. It's called Tulia 2. That one also goes for 100 shillings in Kenya. So let's see how the Postina 2 looks like. So I want us to have a look on how it looks like. So this is Postina 2. Oh my, I don't know if you guys will be able to see, but yeah, it contains 2 tablets. It has 2 tablets, and the dosage instruction is you can take 1 tablet and then take the other one 12 hours apart. So each of these tablets contains what we call levonorgestrel, a dosage of 0.75 milligrams. This is Postina 2 or P2, available in our markets. And then we have this Choice. Let's see how it looks like. So this Choice has like a purple color. There are 2, and how to take it is the same. Each tablet contains 0.75 milligrams of levonorgestrel. So you can take one, then 12 hours apart, or you can take both of them at once. And then we have this one called Tulia 2. So let's see how it looks like, guys. So this one, it looks like that. There are 2 tablets. You can take 1 tablet 12 hours apart. You take the other tablet. So all these 3 are emergency contraceptive pills. There are many instances when this could be important. Number 1, in case of unprotected sex, when your main method of contraception fails. Or number 3, sometimes in cases of rape, we have to give out these emergency pills to the patients. For them to be effective, they have to be taken within 72 hours of unprotected sexual intercourse. They can be taken at any time in your menstrual cycle as a woman, but there are times when these drugs will fail to work. So how do they work? I've said they contain something called levonorgestrel, yeah? When you take these tablets, you take it orally. When you take P2, it's going to inhibit the release of a key hormone responsible for ovulation. So what it does is that it's going to delay ovulation. Now, if you're going to take this drug and yet ovulation has already taken place, it's not going to work. And if you needed it for emergency contraception, then this will not be the option for you. The other option available in the market is the use of the IUCD, the copper one. I'll be talking about that in the next series. So this is going to delay ovulation by about 5 days. when you have unprotected sex, sperms are going to stay in your body for about 5 days. They're going to be viable for about 5 days. So by them delaying ovulation by 5 days, it allows the sperm to stop being viable, and that way you're not going to get pregnant. Now, when taking these levonorgestrel pills, there are things we have to emphasize. Number one, I've said if you think you're ovulating, this is not going to work. You have to think about using something else. Number two is that if you take this pill and you vomit within 2 hours of taking the pills, then you need to retake the pill again, okay? And then the other thing about these pills is that once you take them, in some women, there's what we call breakthrough bleeding. It's a side effect. So in like about a week or so, you will find that you get some pervaginal bleeding. Those are not your menses, and it's not even an indication that this thing has worked or not. It's a side effect. It can happen to anyone who decides to use these emergency pills, all right? And then the other thing is that it's going to have an effect on your menstrual cycle. So it can make you to have irregular periods, but just for a while, for like 1 or 2 months, then everything goes back to normal. In some people, you realize that it makes you have delayed menses. Let's say your menses come after every 31 days. Then once you take this, you could notice your menses coming either a week later. But if it's past 7 days after taking these and your menses have still not come, then there's a possibility that this P2 has actually not worked. Now, the other things that it can make you have is headache, and it can also cause acne. How do you know that this emergency pill has worked? For sure, there's no way to know that it has worked. The surest way for you to know that it has worked is if you're going to get your menstrual periods, and if you do a pregnancy test, which turns out to be negative. Is there a maximum limit to taking this? No. It's an emergency form of contraception. So as long as you have unprotected sex, or you have gone through a situation I've mentioned earlier which could make you require to use this, then you can use it. But now, instead of taking these emergency contraceptions every now and then and the high risk of failure, why don't you go for a regular, a more comfortable, a more permanent or temporary long-acting form of contraception? So are there specific situations where you can't use these? Yes. So in people who tend to be allergic to these, you will not use it. And also in those who have severe liver disease, this could not be the best option for you to use. And remember, I have said you could be having your normal contraception, which you think has failed. So you can supplement and use this one at that time when you think things are not okay. Probably you're taking the combined oral contraceptive pills, and then you forget to take. You forget to take by like 2 days, and you have unprotected sexual intercourse. This could be the best form for you to use. Yeah, so I have seen this trend where people say, I'm going to have sex today, tomorrow, and then on the 3rd day, I'm going to take this. Please don't do that. If you are in a sexually active relationship that is regular, then just go for a better form of contraception. This is not the best. And that is all I have for you guys. In case of any questions, please do so in the comment box. Thank you so much, and may God bless you. If you haven't subscribed to this channel, remember to do so. Bye bye. I love you guys.